Hi, I'm Jennifer Lowe, and this is an episode of MillennialEye Live daily coverage in Hollywood. I have the honor of being here with Cynthia Matossian of Matossian Eye Associates. Dr. Matossian just gave a great talk on a new technology about maintaining pupil size. Cynthia, can you tell us a little more about this?
I'd be happy to, and thank you so much for inviting me. There is a new technology out there, Jen, you're absolutely right. It's a product called Omidria by a company called Omeros, and it is the only FDA-approved product to maintain pupil dilation, meaning preventing miosis intraoperatively, and at the same time providing pain relief to the patient during the intraoperative period and in the immediate postoperative period. The way it works, it's really a combination of two products. It's phenylephrine 1% and ketorolac 0.3%. It comes in a small vial, 4 cc's, and it's FDA approved to be mixed with a bottle of BSS, the 500 ml bottles that we're also used to. And it really maintains that pupil from coming down unexpectedly during the procedure.
Okay, well that sounds really interesting. Can you tell us a little more about your personal experience with the product?
I was fortunate enough to start using it right when it was approved earlier this year in around January, February of 2015, and I've used it on quite a lot of patients. Basically, when I use the product, I know before I even start the case that my pupil is pretty much going to stay where it started at the start of the case. It is not meant to dilate the pupil. That's a misinformation. It's really to maintain pupil size where it starts and to prevent that surprise pupil with patients who are on Flomax or Flomax-like medications, because these patients now also, men and women, it's being used in women, of course, for GU and urinary issues, so that you don't get that surprise pupil coming down. Because with that, the smaller the pupil, the greater the rate of complications.
Well, this sounds like a great technology, Cynthia. Can you tell me a little bit more about the cost of the product?
Well, there has been a little bit of confusion about the cost. It is a product that it is, quote, pass-through, and most people don't understand what it is. Actually, this is a legislation that Congress voted on many years ago, and there's a specific pool of money that is put aside to help companies with innovation and technology. So Omidria is one of 2 ophthalmic products that is in this pass-through pool. And what happens is that this money is set aside, whether it's an ophthalmic product, a anti-cancer medication, or whatever, it is going to be used up. So Omidria was fortunate enough to be one of the 2 ophthalmic products. And right now, it is pass-through, meaning that the insurance, Medicare, pays for the product. Thereafter, once it sunsets, this rule sunsets, and Omidria will no longer be in pass-through after December 31st, 2017. The price of the product will significantly come down, and it probably or possibly may be bundled with the ASC fee, and it will not impact the physician's reimbursement, and it will not impact on the healthcare cost. In other words, it's a healthcare neutral product.
Well, thank you so much for being here today and sharing all your knowledge with us. We really appreciate it.
Thank you very much.